Recording.
Oh, so how falls happen? Falls happen sometimes with housekeeping if they don't dry the floors properly and they don't put up signs, or sometimes they switch um, products that they use that can make the floors more slippery. If there's clutter on the floor or cables, if there's not proper lighting, sometimes depending on patient's condition, they may be confused, dizzy, um, or when patients are waiting for help and no one comes, they try to get up by themselves when they're not strong enough or not feeling well. Sometimes they don't use their walkers, and that causes them to fall as well. When we leave beds unlocked or too high, or wheelchairs are not locked properly, wearing shoes that don't fit or are untied. Same thing with pants. If they're too long and they drag, can cause them to fall. So ways to keep them from falling is to properly put signs up if the floor is wet, or properly dry the floors. Make sure patients are wearing proper size shoes or non-skid shoe socks. Make sure that the floors are clear from any clutter, that there's proper lighting. Uh, Answer call lights on timely manners, and make sure all of the patient's belongings are in reach. Have a toileting schedule so they don't try to get up by themselves. Um, Make sure you remind patients to call for help or lock their chairs or walkers, and often check on patients and always put the bed back to the lowest position possible. Um, we can also make sure that if they have any infections or anything, that they are being checked on more frequent than normal, and always assist the patient whenever you see them having harder days to move around. Make sure that if their pants are too long, maybe either fold them up or try to find better fitting pants. And if they keep getting up without help, you could always try and put the bed alarm or the chair alarm, and toilet them every 2 hours at least.
Statistics. Approximately 36.5% of all deaths in the workplace occur as a result of falling. Slips, trips, and falls made up 17% all work-related fatal injuries in 2014. Mortality rate for patients with acute subdural hematoma ranges from 50 to 90%. A significant percentage of these deaths result from the underlying brain injury pressure on the brain that develops in the days after the injury. About 50% of people with acute hematoma survive, though brain damage often occurs as a result of the injury. Since 1981, it has been strongly held that the critical factor in overall outcome from subdural hematoma is the timing of operative intervention for clot removal. Those operated on within 4 hours of injury may have mortality rates as low as 30%, with functional survival rates as high as 65%. The SHE score is intended to predict 30-day mortality rates in elderly patients greater than 65 years of age with an acute, chronic, or density mixed subdural hematoma after minor or no prior trauma. Slow-growing subdural hematomas, there may be no noticeable symptoms for more than 2 weeks after the bleeding starts. Not needing operation, adults who experience a subdural hematoma with plans to reabsorb may have recovery time within 6 months, while children recover more quickly and more completely. Current guidelines recommended an acute subdural hematoma with a thickness greater than or equal to 10 millimeters or a midline shift greater than or equal to 5 millimeters be evacuated regardless of the Glasgow Coma Scale. A large craniotomy versus craniectomy is the preferred surgical treatment for acute subdural hematoma. Fatal work injuries totaled 462 in 2021 for California, the U.S. Bureau of Labor Statistics reported. It's reported 1 in 1,000 workers are injured on the job each year from falls, slips, trips, and bruises, cuts, among the most common injuries. It is estimated that about 1 person in the U.S. dies every day from a bathroom-related injury occurring either in the bathtub or the shower. Non-fatal injuries for RNs resulted in 19,790 injuries, and that results in at least needed 1 day away from work.
What to do when a fall happens. Assess the room for safety. Leave the patient as they are until assessment can begin. Then you can assess the vitals, perform neuro checks. If safe to do so, offer a pillow under the head until you can safely lift the patient up from the floor. After assessment, pick up the patient. If patient is too heavy to safely lift by yourself, ask for help or use a mechanical lift. If patient can have them assist with moving to bed. What not to do when falls happen. Do not panic. Do not show anger towards the patient for falling or trying to get up by themselves. Do not pick up the patient immediately. Do not adjust the head or limbs. This can increase the risk of potential injury to the patient.
So neuro checks, why are they important? It helps to recognize and therefore manage diseases earlier in their course. It can help confirm or rule out disorders affecting your brain, nerves, and spinal cord. Assessing the patient's mental status followed by the evaluation of sensory function and motor function. And then the different types of neuro checks included are like CT scans, cerebral angiogram, nerve conduction studies, an MRI scan, and neurological examination. The basic nursing neuro check, you're going to start with the mental status exam. It's basically where you're stating your name, where you are, month, year, date, basically making sure they're awake and oriented. Motor functions, the test for that is your arms outstretched in front of you with your palms facing upward. You will then be told to close your eyes and count to 10 out loud without moving your outstretched arms, just to make sure they stay in the same spot and they're not drifting or anything. Your sensory functions, you're going to keep your eyes closed while the examiner lightly touches your skin with a safety pin or any type of like end of the pen or whatever. You are then asked whether it's sharp or dull, the pen that touched to your skin. And then your reflexes, that's going to be the small hammer, is used to check your response with your knee, elbow, wrist, and ankle. So our real life example is the story that we all heard Miss Kim told us in Mod 1. It was about the facility she worked at, and the CNA was giving a shower, and the housekeeping had changed the floor cleaner that they used to use to a new one. And then when the CNA was going to help the patient out of the shower, she slipped and like literally slid and broke both of her arms. And then when Miss Kim had gone in to help, she also slipped and broke an arm. So both her and her CNA were out for like a couple weeks because of the incident.
Questions for the audience. Number 1, it's dubbed the Fatal Four by OSHA. What are the 4 categories of fall hazards? Number 2, what are 3 types of falls? And number 3, what is the number 1 cause of falls?